think of breast cancer, lung cancer, that kind of stuff. Brain tumor is in a category of its own in the sense that the word cancer is not really used to describe brain tumors.
Colon cancer, renal cancer, they have higher tendency to spread to the brain. And a lot of times they have like multiple brain metastasis.
Buenas Day. I'm Jolene Tovis, and welcome to My Story. Today we are talking about cancer. Cancer is non-discriminative, and it can affect anyone, no matter of age or race. Today we're specifically talking about brain cancer with GRMC neurologist Dr. Kwasi Nyame. Welcome.
Thank you so much. Happy to be here.
Thank you. Now, we're specifically talking about brain cancer, brain tumors. Let's first talk about the difference between a tumor and cancer.
So when people think of cancer, they think of breast cancer, lung cancer, that kind of stuff. Brain tumor is in a category of its own in the sense that the word cancer is not really used to describe brain tumors in the sense that brain tumors are either high grade or low grade. High grade means it's more aggressive. So it amounts to what people will call malignant cancer in the body, or benign cancer would be the low-grade type in the brain. And so we don't use the word cancer so much in the brain. The main types in the brain are tumors that started from the brain, which are called glioma, because the glial cell is the basic cell of the brain. And that can be either high-grade or low-grade. Another tumor is called a meningioma, which is a tumor that comes from the coverings of the brain. And then the last one that's also very common is something called metastatic disease, which means that patient had breast cancer or lung cancer, and the tumor cells or the cancer cells actually migrated into the brain and started forming. And those are the three common types of brain tumors or brain cancers, as you can see for the most part.
All right. Now, cancers and tumors, they progress and develop over time. And in some cases, it takes years before an individual even knows that they are afflicted by this disease. What are some of the signs and symptoms that a person should be looking out for and aware of when it comes to tumors developing in the brain?
That's a very good question. Some of the common symptoms are seizures. Seizures in older adults is not common, and so if you have a seizure, it could be that there's something irritating in the brain, like a brain tumor. Another symptom is weakness on one side. We as neurosurgeons know that the brain has different functions. And so I brought a skull today to kind of show you guys. You can see here that this is the front, here's the back, and then here's the face. We're going to take off the skull cap, and we actually see the brain. So here's how the brain looks like. Now, I've only shown you half of the brain, so I can show you the inside part of it. There's the frontal lobe, there's the temporal lobe, occipital lobe, and parietal lobe. All these parts are responsible for different things that the body does. The temporal lobe on the left side is responsible for language and speech. So if a patient has difficulty talking or understanding language, there's a problem. It may be that there's a brain tumor. If a patient has difficulty with trying to plan out their days or forgetting their keys or things like that, and it's become a constant thing, the frontal lobe does that. So it may be a problem. If a patient has a problem seeing and not able to visualize things or bumping into chairs, it may be there's a tumor in the occipital lobe, because that's the part of the brain that processes vision. So these are all the common things that you can find in patients with brain tumors. Your question about catching the brain tumor early is very important. I brought a folder of a patient that I took care of. The patient gave me permission to show this. This was the MRI picture of the patients. You can see this is the left side on the temporal side. This is the right side, temporal side. Here's the frontal, and here's your occipital part, or the back part. You can see here, there is this whiteness on the temporal side. This is what a brain tumor looks like on MRI. This is the eye on the same side. We're looking at it from the side view. This is this over here. So this started 5 years ago. And over time, it progressed to become what we see here. You can see how much larger it is now over time. And so if we can catch the tumors early on, we can treat it and patients would get better.
I noticed in your pictures that in comparing the growth, in the first picture when it was first caught, it seems like there was this outer white ring, but as it progresses, it seems like that whiteness kind of diminishes. Why is that?
What happens is you can see also that there's this darkness around the tumor. The darkness is swelling. Whenever there is anything irritating the brain, it responds by swelling. And when the swelling happens, it pushes on known parts of the brain and causes symptoms like weakness, the seizures, difficulty speaking, things like that. And then the white is basically active tumor cells. What happens is the tumor grows. Where it's actively growing, it turns white because we use a material called contrast so that we can see it. So when we do the MRI, we actually inject this contrast into the bloodstream. The parts that are dark is the dead part. It's in the center because as the tumor grows, it doesn't get enough blood flow. And so what happens is the white part is the active parts of the tumor, and then the center part is the black part is the dead part of the tumor.
Okay. Now, in looking at the size of the mass in the brain, you would think that there would be pressure. Now, with symptoms and the pressure, is it like an immediate, or like it just hits them right away, like out of the blue? You just have like a migraine or something of that nature where the symptoms just appear out of nowhere, so to speak.
So we wish that were the case because it would be easier to detect these things. You know, an aneurysm is an example of what you talked about. It just happens and patients have this massive headache. But brain tumors, depending on what kind of brain tumor, if it's a low grade, it's going to take years to grow. And so patients get used to it. And so they don't think there's anything wrong because they've been like this for
It's
years.
like their pain tolerance increases.
Exactly. If it's a high grade type of tumor, the progression may be a little bit quicker, but still, it's not like an aneurysm where it just happens right away. It still takes, several years. Nowadays, with high grade brain tumors or high grade gliomas, the survival is up to about 14 months, meaning that if you're diagnosed with a high grade glioma, which is called a glioblastoma or GBM, your life expectancy is 14 years, and that's with maximum treatment to include surgery, chemotherapy, and radiation. So you have 14 months from the time that the tumor starts growing to the point where you eventually die from the tumor. 14 months is a long time. So over time, you basically get used to the symptoms and you don't really feel that there's any big change until it gets to the point where you really notice the patient's getting weaker on one side, not able to speak, not able to take care of themselves, and so they look very disheveled.
Okay, now, typically, how many years or how long goes by before a person realizes or actually knows that, hey, something's wrong, and they go and get checked? Because oftentimes a lot of there's this stigma where some people, they just don't want to go to the doctor. They know something's wrong, but they don't want to go because they're afraid of confirmation. Now, so on average, how many years have passed by with people who are suffering from cancer?
I've had the fortune to practice in different parts of the United States. I've noticed that in parts of the United States where access to healthcare is limited, patients come to me when it's almost too late. At least 6 or 7 months have passed by since their symptom onset before they come to see me. Where I practice in a more affluent part of the country, within weeks or even at most 1 month, patients are coming in to see a doctor. So I think the answer to your question depends on access to the healthcare and the socioeconomic status of the community, in the sense that patients that don't have the resources tend to present much later. So really the average time span is anywhere from weeks to, I would say, several months.
All right. Now, you mentioned that there were different types of brain tumors. Now, between the low grade and the high grade tumors, what are the treatments? Like if I came in and I had a high-grade tumor, like where would I go from there?
So typically you would see either your primary care doctor who would think to get an MRI of the brain, which is the scan that I showed you. They would see the MRI, the radiologist would read the MRI and say that there is a concern for a brain lesion. You would then be referred to either a neurologist or a neurosurgeon. It's more common that you see a neurologist first. The neurologist would examine you, find out that most likely your symptoms are coming from this brain mass. They would then send you to a neurosurgeon, which is what I do. That's my specialty. The neurosurgeon, depending on their training, would go from there and decide the treatment options. I have a subspecialty in brain and spine tumors because I spent extra time studying that. And I'm also board certified, and so I'm equipped to treat brain and spine tumors. So what I would do is I would talk to you about the options available. Like I mentioned, the maximum treatment for high-grade glioma includes chemotherapy, radiation, and surgery. The surgery is to decrease the tumor burden. If you don't resect the tumor out and you give radiation or chemotherapy, there's still a lot of tumor there, and so the radiation and chemotherapy will not have a chance to work. Also, we need to know what kind of tumor you have, and so the reason why I do the surgery is to find out the type of tumor.
It's a biopsy.
It's a biopsy, exactly. So it's a resection and a biopsy. The pathologist looks at the tumor and tells me, this is what the tumor is. This is high grade or low grade. Based on after resection, we then send you to a radiation doctor who then decides to do radiation. He can do whole brain radiation, which is the whole entire brain, or focused radiation. And then afterwards, you go see an oncologist, neuro-oncologist. They then give you the chemotherapy to treat the tumor. That's usually the stepwise production.
All right. Well, thank you so much, Dr. Yami. Well, don't go anywhere after this break. We'll be back with more talk on brain cancer. Welcome back to My Story. Earlier we spoke with Dr. Yami, who shared with us the signs and symptoms of a brain tumor. Now we speak with GRMC oncologist Dr. Song-Chu Ko about what happens after a person has been diagnosed with a brain tumor. Doctor, can you share with us, I've been diagnosed with brain cancer. What's next for me?
Okay, so it really depends on what type of cancer you are diagnosed with. And for example, if it is glioma, like Dr. Naomi explained to you, once you see something like that, the best possible outcome, if you want to achieve that, you need to have maximum surgical debulking, yet safe, without causing any neurological consequences. And then I come in with the radiation, maybe plus minus chemotherapy together. That would be the optimum way of managing glioma cases. If it is like a metastatic cancer, for example, lung cancer, breast cancer, colon cancer, renal cancer, they have higher tendency to spread to the brain. And a lot of times they have like multiple brain metastasis. So in that setting, the surgical resection is not really possible because there are just too many to take out. So in that situation, I just offer them like a very short 2-week course of radiation treatment without the chemo. And then I usually send them back to chemotherapy doctor for additional treatment.
All right. Now, there are different variations of a brain tumor. There's the low grade and the high grade. Now, does that determine what type of treatment is provided?
In terms of radiation, you're asking?
In terms of radiation, yes. Like if I came in with a low grade tumor, how much radiation treatment or chemotherapy, or is it that even in the path towards trying to get rid of it for me?
It really depending on size of the tumor and then how many there are. Okay, so for example, If in the metastatic, like a lung cancer with many, one or two brain lesions, which is small, then generally we recommend neurosurgeons to go in and take it out. Once they achieve the resection, and then I recommend the whole brain radiation for 2 weeks. And there was a study done in 1990s performed by Dr. Patchell. He actually compared this patient who had one brain lesions and offered them surgery followed by whole brain radiation, and compared this population to just whole brain radiation alone. And that data showed that those people who had a resection followed by whole brain radiation, they survived better, and they had much better neurological outcome. So in that setting, we generally, even in metastatic cancer, we offer surgery followed by whole brain radiation. In terms of glioma population, we generally recommend fractionated external beam radiation. External meaning that the radiation is given off from the outside of the patient body. And then it may take about 5 to 6 weeks of daily radiation treatment, Monday through Friday. So for high-grade glioma, we generally recommend about 33 daily treatment with chemotherapy.
33 treatments.
33 daily treatment.
Wow, that's a lot. Now, with patients coming in, do you find that they're afraid? I mean, because being diagnosed with a brain tumor is a scary diagnosis to be told. And having to go through radiation and chemotherapy, there are side effects that occur,
Yes.
which may make the patient kind of like, I don't know if I want to do it, but what do you do in that situation where you're trying to make someone heal and recover, but they're just afraid?
Sure. Compared to like a chemotherapy where it can create a lot of problems inside the body, radiation is pretty local treatment, just like a surgery. So radiation can only affect where we are treating. So in case of brain tumor setting, any kind of side effect would be just happening here. Okay, so typical most common side effect would be like hair loss, for example. And then radiation can cause like fatigue symptoms. And then radiation may or may not cause maybe some mild nausea, maybe vomiting symptoms. And then depending on where the location of the tumor is, if it is in the motor cortex, for example, or if it is in the, like a memory area, then radiation can affect maybe general slowdown of cognitive function or cognitive ability, or it can also affect like a short-term memory with the radiation treatment.
All right. Now, you, of course, provide the treatment for radiation. How many patients have you seen or have you treated with brain tumors following the radiation treatment plan?
Well, before I came here, I was a faculty member at Indiana University School of Medicine. When I was working there, if you are working in academic institution, even same radiation oncologists, we tend to specialize. So we choose the side of our expertise, and my expertise happened to be brain tumor as well as a GU tumor, which is a prostate and bladder cancer treatment. So in my career, I probably treated close to 500 to 600 patients so far with a brain tumor condition.
Wow, wow. And the treatment, of course, is different for each. It's tailored to each specific case, correct?
Yes,
Yes.
very, very highly individualized. Let's
Highly
put it there.
individual. Yes, yes, yes. Now, what happens if a person is not responding well to radiation treatment? Where do they go from there?
That's a very good question. Sometimes in high-grade glioma case, rarely, despite of the radiation, we do not really achieve symptomatic improvement per se. And then in many cases, patient come back to us with a recurrence in very short time period. You know, even after radiation, in like 4 to 8 weeks, they come back with a recurrence, which can happen. And then sometimes the radiation failure occurs inside of where we radiated. So in that setting, it's really, really difficult to add additional radiation because it can cause what we call brain necrosis or radiation-induced necrosis. So what do I mean by that? When I see brain necrosis, that area becomes like liquefied. So it just becomes like dead tissue and the liquid pull up, sort of like dead material. So if in that kind of setting, we generally do not offer additional treatment, and I generally recommend maybe hospice if it is available. And that's actually another topic that we need to discuss. There is no good hospice care on this island, but that could be like another day's topic discussion.
Oh, I'm glad you brought that up because typically when residents on island are diagnosed with something serious like cancer or tumors, they often feel like first response, I need to go off island and seek treatment off island. But there's treatment available here. So can you share with us how we compare to what's provided, treatments provided in the States for specialized treatments such as brain tumors?
Sure. I mean, in terms of the radiation treatment, I just want to inform everybody who's watching this show that we have probably the best machine that's available out there. It's called TrueBeam, made by Varian Company. And when I started working here in GRMC, I think, when did I start? 2015. That machine was not even available in Indiana University School of Medicine.
Wow.
So having said that, in terms of radiation, I don't think people need to go off island to get radiation care. That's my opinion. Could be biased, but.
All right. Now, once treatment has started, how long will the treatment continue before they see any type of progress in battling that tumor or decreasing it in size, right? Because that's what the radiation does, is it shrinks
the tumor and sometimes kills the tumor, yes.
All right,
yes.
so how long on average would that take before the tumor starts to shrink?
That's actually a very difficult question to answer because meningioma, it doesn't really go away, for example, okay? Our success will be defined by as long as the tumor just stays the same size before or after radiation, that would be called our success, okay? In some spinal cord compression cases, if we offer radiation, we can see the result immediately within like a couple days even. You will see a better motor functioning, recovery of the motor function with the radiation treatment. So.
All right. Well, thank you so much, Dr. Ko. Well, don't go anywhere. My story will be back right after this. When it comes to cancer, getting the right treatment is necessary. Join us on April 29th as My Story takes a look at American Cancer Society's biggest cancer awareness event, the Relay for Life.